So it is our first engagement event this evening, and as I say, you're very welcome. We will have a chance to hear some of the updates from our experts about the situation concerning COVID across Suffolk and North East Essex, and also a bit about the vaccination as well. So we've got a number of our clinical experts who will be on hand and available to answer your questions and also to give that overview as well. So as I say, welcome along. We're going to start first of all by handing over to Andy Yakub, who's the Chief Executive of Healthwatch. Before we hear from Andy, let's cross over to Gulshan to set a bit of context. Gulshan.
Thank you very much, Simon. Welcome everybody to this event. I'm just going to set out the purposes of this evening's event. First of all, this event's been set up to address the questions relating to the COVID vaccine. Some of you may be very keen to find out exactly where to get the vaccine, you'll be very keen to get the vaccine. There may be others who've got real concerns about the vaccine. And as part of that, we need to acknowledge some of the issues that have happened in the past. And I think particularly around Black communities, to acknowledge the ways in which perhaps in the name of medical science there's been horrendous abuse of medical science. I think we need to lay that in the open in terms of developing trust and partnership, which I think are the other aims of tonight. This is an opportunity for you to have your say and to hear briefly from some of our panel members as well. COVID isn't going to go away. The bank holiday period is this week. And we know from recent announcements that if anything, the situation is getting worse rather than better. But we're very keen to hear about local people's experiences of receiving the vaccine. And we are very, very keen to hear the questions you've got and any concerns, and to know about any barriers and anxieties you might have, or any barriers that there might be in terms of receiving the vaccine, so that we can make sure we make it available to everyone and that all communities are well served by the CCGs. I'll now pass you on to Andy to introduce the panel.
Good evening, everyone. My name's Andy Yakub. I'm the Chief Executive of Healthwatch Suffolk. Thank you, Gulshan. I'd like to introduce the panel, who will themselves speak following me. We will start with Stuart Keeble, who's the Director of Public Health for Suffolk, and then we'll move to Dr. Juno Jesuthasan, who is an Ipswich GP. Following Juno will be Dr. Hassan Sharan, who is a Colchester GP, and then we'll have two community members speaking together, Shaura Begum of the BSc Multicultural Services, and Shirley Powell, who's the founder of Your Life in Your Hands Health and Wellbeing Service. After that, we'll hear from Siobhan Kranjan-Naslir, who is leading on integration and partnerships for Ipswich and Suffolk Council for Racial Equality. And finally, Dr. Ed Garrett, the Chief Executive for the Clinical Commissioning Groups across Suffolk and North East Essex, will close the event.
So thanks, Andy. As I say, let's move across now to our first speaker, and Stuart Keeble, the Director of Public Health at Suffolk County Council. Stuart.
So thank you, everybody, and good evening. So I'm just going to spend a bit of time just briefly talking about 3 points about where we are at the moment with the COVID pandemic, and recognising that actually we want to spend most of the time talking about the vaccination, but clearly we're in a challenging position at the moment, and there's a lot of news at the moment around this new variant, this new type of form of the virus. The speed of change that we have unfortunately been seeing over the previous kind of 4 weeks, beginning actually with when the lockdown came to an end, where we were seeing massive increases in cases across those areas. So clearly of concern, and meant the government had to take action very quickly. But unfortunately, what we're now seeing is actually an acceleration across other parts of the east of England at the moment, which includes parts of North East Essex and also Suffolk. And really, really big increases, parts of Suffolk, so areas such as Mid Suffolk, which are kind of north of Ipswich, and Babel, which kind of runs underneath Ipswich, are seeing really considerable increases in rates, kind of up to 180% increase over the last kind of 7 days. So what this means is at the moment is the virus unfortunately is really taking hold. And I suppose my key message to that is that now more than ever we need to imagine that actually either you have the virus or the people you're with have the virus, and we need to use that to guide us. If you imagine that about how you might interact with people. And some of the reason why this rate, we think the virus has been increasing so massively, is because of what's called this new variant, I suppose a new flavour of the virus, to put it bluntly. And what we're finding is that this virus is a lot more infectious, is a lot more easier to catch. It's not necessarily any more dangerous to an individual, so it won't make you any more sick than the current virus. Although clearly, if you're maybe have certain health conditions or of an older age group, then there are risks associated with that. But it just means that it's a lot easier to catch it if you're in close contact to somebody else. And I appreciate that they're not the things that people want to hear, but we're really just trying to stop the spread of that virus any further at the moment and protect lives. We are seeing increased numbers of hospital admissions, which is obviously what we don't want to see. So at the moment, I think ultimately we have the vaccine on the horizon, and Juno will start to talk about that, and we are starting to see it being rolled out. But at the moment, we've just got a bit longer before we can start to meet up and have the contacts with the people that we did beforehand, and people need to be patient for now. But we will get through this. But at the moment, the trajectory of the virus means that we've got to be even more careful now than what we probably have been.
Can I just ask a question of Stuart? The new strain of the virus, does that mean that we need to reconsider 2 meters as being a safe distance?
Not at the moment, Andy. I think at the moment it's the same guidance that we've always had. We need to follow. But I think it's going back to that, imagining that you might have the virus or somebody else, and just keeping that distance. As our understanding evolves, that may change. But at the moment, from what I'm hearing from the government scientists, is that we just really need to follow that guidance and try and keep that 2 meters and try and reduce unnecessary contact with other people at this point in time.
Thank you. Thank you.
Oh, hi, I'm Juno. I'm a GP in Ipswich. I'm also a prevention lead for Ipswich and East Suffolk CCG. And I'm just going to tell you a little bit about the virus. I'd like to thank Stuart for giving us the latest update. So at the moment, the vaccine has been rolled out in Suffolk for nearly 2 weeks now. The first week, the hospitals vaccinated people, and this last week, or maybe 5-6 days, the GP practices are rolling it out. And you may have heard the term PCNs, primary care networks. This means that more than one practice are working in partnership and beginning to vaccinate their patients and healthcare workers. It really is a question of don't call us, we'll call you. Funnily enough, with the vaccine, there are those people who are just falling over themselves to be vaccinated as soon as possible, and a smaller percentage of people who really don't want to have the vaccine. So we can talk about that in a minute. But those who do want the vaccine, we encouraging them not to contact the practice, because of that it'll just make it harder to get through to your practice for routine appointments. Reports have been run, lists have been drawn up as to who is eligible for the vaccine. So initially it's the over 80s who are being in the first cohort, and care home workers, and then that is spreading also to NHS staff. Then it'll become people who are over 75, then over 70. And with those over 70s, those people who were classified as being extremely clinically vulnerable. If you or anyone you know was in the shielding group, that's what they mean by extremely clinically vulnerable to COVID. They'll be done with the 70 to 75-year-old group. The other thing is BAME people. At one point, I was being asked, why are BAME people being guinea pigs? The answer is they're not being guinea pigs. They're not amongst the first groups to be vaccinated. In fact, BAME patients are not being singled out for vaccination at all. But remember, just to clarify that in every one of those risk groups, over 80s, health and social care workers, over 70s, vulnerable, extremely clinically vulnerable. There are BAME people in all those groups. So to touch on Gulshan's point earlier as to whether any particular groups are being used as guinea pigs because of their ethnicity, the answer is no. But we are all part of individual groups based on our age or whatever. So please make sure you get the vaccine, because that is really the only way that this pandemic is going to end. I was meant to talk for 5 minutes, but unfortunately I didn't set my timer as I thought I had. So I've probably got another couple of minutes. So, okay, at the moment then, it's the Pfizer vaccine which is being rolled out. One of the reasons it hasn't been rolled out to care homes in a big way yet is because it has to be stored at -70 degrees centigrade. This is a real problem in getting it to places where it's needed. However, it's a really good vaccine, 95% effective, and rollout to care homes and other vulnerable groups who can't get to the surgery will happen in due course. The second vaccine candidate is likely, in my opinion, to be AstraZeneca Oxford. It's a combined thing which is now being looked at carefully by the regulatory authorities to see whether it's considered to be safe to roll out. Very quickly want to touch on the fact that some people feel has it been rolled out too quickly, because it normally take 10 years for a vaccine to be approved, and this has been approved in less than a year. Well, first of all, it hasn't been approved yet. It probably will be in the next few weeks, but even that would be just a few months compared to 10 years. Well, the answer is that all the steps were taken, but they were taken, if you like, in an overlapping fashion. There were loads of volunteers. Normally it's hard to get volunteers to put their hands up and say, I'm happy to be vaccinated as a guinea pig. But loads of really caring people said, I'm happy to stand up and be counted, give me a vaccine. Loads of money was spent on this, it was prioritized. So the answer is it safe? We can go into it later if you want more detail, but it is safe. Does it pass the mum test, as the Deputy Chief Medical Officer Van Tam asked? The answer is, I think it does. My parents, who are both over 80, have had the vaccine already. Very happy for them to have it. My mother has allergies, and she had the vaccine. If you've had a severe allergy where you needed resuscitation or you couldn't breathe, your lips swelled up, in other words, what they call anaphylaxis, you should not be having it. The other very quick question I want to address is, tens of thousands of people have been in the trials, but remember that tens of thousands of people is not tens of millions of people. So rare side effects that affect 1 in 100,000, 1 in 500,000, 1 in a million will not be apparent until it's rolled out. And if you are one of those people who feels more comfortable having something after other people have had it so that you feel that it's safe, then that's not a problem. You should wait, because believe me, there are literally millions of people who would gladly take your place in the queue. But what I would say is, once you're satisfied that it is safe, and remember, nothing is 100% safe. Thousands of people die every year from taking aspirin or ibuprofen, because both of those drugs can cause gastric bleeds. So even though they may help your joints, they may thin your blood and reduce your risk of stroke or heart attacks, a percentage of people will have serious side effects. So doctors should never say that a vaccine or anything else is 100% safe. But what we do know is that it is very safe. The benefits of it far outweigh any risks. And I think I would strongly encourage you to have it when you feel ready to have it. The more of us who have it sooner rather than later, the better it is to end this pandemic and get people back into any form of normality. I think my 5 minutes is up. Thanks very much.
May I now invite Dr. Hassan Charan to speak, please.
Thanks, Andy, and thanks everyone for the information so far. Thank you, Juno, for your talk. So I'm going to move on a little bit and just talk about practicalities about how we're going to try to get this done or start to get this done, or indeed actually have already commenced getting it done. So firstly, I must reiterate that the vaccine, as said before, is not a substitute to all the requirements and government guidance around social distancing, etc., etc. So please bear in mind, even if you are vaccinated, it doesn't suddenly give you a Superman type shield that means you're allowed to go out there and flaunt government guidelines. It's not intended to be that way. So how are we going to do it? So I suppose I'll start by saying what sort of centres are we going to be doing this at? So we've got, largely speaking, 3 centres. They're the hospital vaccination sites, PCN hubs, and PCNs are primary care networks, which I can talk about shortly. I've got to remember to stick to my 5 minutes. And then followed on by mass vaccination centres. Now, locally, we've started 2 out of the 3. So we've had hospital hubs. So at the hospital site across Ipswich and Essex and Suffolk Foundation Trust, they've delivered almost 8,000 doses of the vaccine, having started their process at the start of December. And they've been vaccinating a cohort of people, including care workers, at-risk frontline NHS workers, and the over 80s patients, inpatients and outpatients. But that's very soon going to move over to be the responsibility of primary care networks. Now, some of you may know, some of you may not, but over the last year or so, general practices have been coming together to work as primary care networks to work more collectively to try and share workforce and try and share delivery of certain things. And actually, that provides a fantastic opportunity for something like delivery of the COVID vaccine. Now, one thing worth bearing in mind is that this is a massive logistic challenge. As Juno said already, storage of the vaccine is a challenge, but it's not just a storage. It's once you thaw it out, they're coming in batches of 975. Once they're thawed out, you've got to use them up in 5 days. Once they're out of the fridge, you've got about 6 hours. And each vial comes as old-fashioned vials where you have to draw up the vaccine independently, and there's 5 doses per vial. So somebody has to sit there and manually draw up 5 doses from each vial to then deliver the vaccine into the muscle. So it's by no means an easy challenge of hit and go. And so it means lots and lots of logistical planning. Not to bear in mind, as I said, we've still got to bear in mind the social distancing. And we've got to make sure that after you've had the vaccine, there's a period of observation for 15 minutes. So massive challenges. But the amazing thing is how everyone, and I mean everyone, not just NHS, healthcare, voluntary services, people in the local community, have come together to bring this all for our patients, for our public, so that we can start to vaccinate everyone, so people can start to develop this immune response, and so we can start to get our lives back to normality. So where did we do this first? So the first place we did it was last week. We started in Clacton, and this was at the Tendring Centre, previously used by St Helena Hospice. And so this is where St Helena Hospice, staff from East Lynn and other community partners came together to deliver the vaccine programme in Clacton, where they had to do everything that I just said, get a bunch of vaccines, 975 doses, and deliver it to members of the public in the over 80s range. Now that's been a success. We did that last week. And now we're about to do exactly the same thing here in Colchester, starting tomorrow. So we'll start the same process again, where we've got 975 vaccines. And we're going to be using the same processes where we'll be administering the vaccine using a combination of volunteers from practices and again from the local community. As Juno has said, we've got lists that we've submitted of all our over 80s patients so that we can start to invite these people. Please don't contact your practice to ask when you'll have your jab. We are proactively contacting people and we're working at the minute on the basis of area with the hope to expand it as more and more vaccine comes down the line. Now, these are the 2 sites that we've got in Northeast Essex. I gather there's around 20 in total across Suffolk and Northeast Essex that we'll be rolling out. So over the period of the next few weeks, as we get more and more familiar with how this works, as staff get more familiar, as we start to understand the processes, we can get slicker and get better at delivering this. But the important thing is that everyone is working together to get this done, and you will be called when it is time for you to get your vaccine.
Just a couple of things of note. Very important message that if you haven't heard yet, it takes time to get through all those people in that first priority. So just you're asking people to be patient. They may not be contacted until mid or even later in January. And the other thing I think is probably important to say is that every person that receives the vaccine has to remain in situ for 15 minutes whilst they're being observed before they're allowed to go home, aren't they?
Indeed, that's the guidance at the moment, and so you need to plan for that if you're coming to the centre. I suppose one last thing, if I could mention, is probably just DNAs. So as Juno said, if you don't want the vaccine and you've been invited, please let us know as early as possible that you don't want that, so we can make arrangements for it. Because actually there have been a small proportion, but still some people that haven't attended for the vaccine. And when you've got to go through this whole process to draw up the vaccine and get it, the last thing we want to do is be in a position where we're wasting valuable vaccine.
Thank you, Hassan. Can I now invite Shirley Howell to speak, please? Shirley?
I am Shirley, founder of Your Life in Your Hand, but I'm also a health and wellbeing lead for a group called Suffolk Black Community Forum in Suffolk. I just want to share with you about the support that is out there for the Black community at the moment. Some of you may not have heard of the recently formed Suffolk Black Community Forum, which was started up around just in the summertime in the lockdown to support the Black community and African community with anything around health, around education. And we do have a website, which I'll share the link so that you can check it out for yourselves if you would like to attend any of the meetings. We normally meet fortnightly, and it's from 5 to 7 on a Friday. There's also the Caribbean and African Suffolk Health Forum, which has recently just set up a befriending project, which will help and support the Black and African community as well. It's been set up, particularly in this time of isolation, that people can have a conversation with somebody on the phone if they need support with their shopping, if they need somebody to talk to, just to talk about for an advice, and many who are living alone. And that is for the over 50s. So I will also share that website as well for you should you need to contact the forum. And then there's myself. I'm the founder of Your Life in Your Hands. I actually offer health screening and advice and support around how you can boost your immunity, how you can live and stay well. And you can contact me and I will share the link as well. Thank you very much.
So important to hear what's going on at a ground level, absolutely, because that's where people speak to each other and rely on each other. And we get those messages across tonight. Thank you. I'd now like to invite Siobhan Pranja-Narsil to speak on behalf of ISCRI, the Ipswich and Suffolk Council for Racial Equality.
Hello, good evening. My name's Siobhan. I work for ISCRI, as Andy just indicated, as Integration and Partnerships. I'm here really just to inform you all about what we have been doing, what work we've been doing. We've really working in partnership with the Ipswich and East Suffolk CCG to support our community with key COVID information coming out into the community. We've been doing this in various ways. We've been getting the information translated into the key languages for our county, getting it sent out via infographics. We've been making videos with members of our community, and we will continue to do so throughout this period, but also going into the future as well. Really, ISCRI want to be there as a conduit for our community to cascade this information and support you with any grievances or issues that you may have, and hope that you feel comfortable coming to us, and then for us to get the information out there and the answers that you need.
You know, whilst you're speaking on behalf of Ipswich and Suffolk Council for Racial Equality, in a way, you're voicing what's on offer out there as an umbrella organisation for the community at large, and we could have plenty of other speakers here supporting you in what you've just said. Thank you. Can I now? We don't have Shira here from the BSc Multicultural Services, so can I now invite Ed Garrett to close this part of the event?
So. If it's okay, Andy, we will love to open out to questions, and we'll all endeavour to address the points that will be made. Thank you.
Thank you very much, Ed, and thank you, everyone. Can I hand over to Gulshan to chair this bit and the Q&A?
Yep, thank you very much, Andy. That's really helpful. So we've got a number of questions, and the first question is accessible information needing system adjustments to make sure that anyone with learning disabilities, autism, has the vaccine. The adjustments that need to be made and around the specific needs of people with autism.
So I mean, as I said earlier on, that there are some logistical challenges around this vaccine. So it's a little bit old-fashioned in terms of the way it's got to be drawn up. So that means physically having to use a syringe and a needle and actually draw it up in the vial. So at the moment, it's not something that I'm aware has been given that much consideration, but it definitely does. What it does do, though, is it opens up possibilities. So whereas we're able to get things like concealed needles for people that have got needle phobia, that might be something that we're able to adapt because we'll be using normal syringes and be able to basically use our current clinical equipment, but modified as it were. I think really the honest answer is probably we're so early on in the process that in terms of the actual availability and delivery of the vaccine, we're quite limited in our options in terms of what we can do. So some of this is what has to develop over time.
Yeah, I mean, I think it's important that the needs of every single community are met and addressed. The best way of dealing with any concerns that people may have, apart from making sure that information is available in accessible forms, is really, if you have any doubt, then you should be contacting your GP, really, I think would be the best person, because they can actually tell you in hopefully in a way that is meaningful, the pros and cons of the vaccine. We know that written information is often quite hard for people to digest if they have learning difficulties and so on, whereas a conversation with someone, often via phone, GPs now can actually also do it via a video link, so that the person who has the concerns, the person who's at risk, whether they have autism or learning disabilities or whatever, and whoever else they want in on the conversation, those people who look after them, friends, family, loved ones, can ask the questions collectively so that everyone is comfortable with whatever ends up being delivered. So I think it's multi-channel, including making things available in formats that are easy to understand, easy to read. I think some of that work's already been done, but sometimes individual groups can be missed. Those aren't always that successful. So, make contact with your practice if you fit into any of those groups and have any questions. I don't know if Hassan would agree that the GP should be the person to ask under those circumstances.
And as part of the rollout of the vaccine, we're starting to work together to look at different groups, different community groups, different to try and understand what issues and challenges people might face. So I think as part of that piece of work, what we need to do is to work with different representatives, different communities to actually understand those challenges. So part of that clearly is important to talk to your GP, but also more systematically, we're going to try and do that piece of work so then we can then build that into the wider rollout and actually have conversations to understand what are the challenges and what are the issues, and then we can then help as time goes on design, change, or make sure that the information is in the right form to get across. So there'll be a wider piece of work going on, trying to identify which groups might find it challenging to access vaccines, might have particular needs, and then hopefully feed into that wider rollout going forward as well.
Thank you. So I just wanted to add that we must remember that the cohort of people that we're talking about usually fall within a similar cohort of people that we've been administering flu vaccines for, and so there are usually processes in place. And Juno asked earlier whether I thought it's for the GP, so it may very well be, but different places have different setups, don't they? So for example, for particular, if the individual has a family member or someone who they trust more than anyone else, then it's usually about using the options that they've used in the past. So when we're looking to deliver something like a flu vaccine, if there's issues or concerns around it, people have now developed systems or ways to get that communication across. And so it's about, not reinventing the wheel and using some of those traditional methods that we've been using for things like flu vaccine and just basically adjusting it a little bit so that we can use the same vehicle to relay that information.
Thank you. I'm really glad that Max has popped in and raised this, because I think we know data-wise that people with learning disabilities have felt the impact of COVID and inequalities greater than almost anybody else. And the other thing that concerns me is that as a health system nationally, not just locally, we struggle to even comply with health assessments, annual health assessments for people with learning disabilities and autism. So this is a huge challenge, and I would implore anybody in the system to work with key advisors like ACE Anglia, for example, in Suffolk. I don't know what there is in North East Essex, where they can help GPs and practice managers and others to ensure that you go about the right way in order to maximise the possibility or the probability of a patient who has learning disabilities to come forward and accept this vaccine.
Brilliant. Thank you very much, Andy. And I think I absolutely second that. We've got lots of people working within the communities who can act as our conduits to make sure that the needs of all communities are met. Another question, possibly, Stuart, you might want to start with this one, possibly, but it's from Anonymous. And how do we know this vaccine will work in the light of the new strain?
I think the first thing to say is that this is such a fast-moving situation that our understanding is developing. Now, clearly, this is a new strain of the virus, so it's not a new virus. It's what viruses do. They evolve and they adapt and they develop. So parts of the virus have changed somewhat. So I was on a call with one of the clinical leads who's leading a lot of the work around this this afternoon. And what their view was that they didn't, at this point, they felt that they couldn't see a reason why the vaccine would not work still. But what they're doing at the moment is they're going to do some testing over the next couple of weeks to actually understand exactly how the virus mutation has affected the vaccine and how the vaccine may impact on that. But from talking to them, they felt relatively confident that actually that from what they can see and how the virus has mutated, that there shouldn't be any reason why not. But as I say, to do that, they will do some tests. They'll get some of the virus and they will see how the vaccine works on that within a lab setting. But as I say, literally, the knowledge on this new mutation is literally developing by the day, and with the whole of this pandemic, everything is very fast moving. So as and when we know, then further information will come out on that.
I think the flu is an example. Every year there's a different strain. The influenza has mutated, and what the vaccine companies do is to just change their formulation a little bit. Someone actually said that if this new variant results in the current vaccine recipe not being the best recipe, then it's relatively easy to just modify that recipe so that it is effective. So the answer is, at this stage, no one knows the answer. Is it going to be as effective? The answer, it may well be as effective. Just because something is more infectious doesn't mean to say it's more dangerous. You know, it could be that the vaccine would cover all these possibilities anyway. But if it isn't, then adjustments can be made so that an effective vaccine continues to be rolled out.
Are young people in schools and colleges spreaders of the virus, including the new variant?
Where we've seen the new variant develop in the southeast, so in Kent and London, and in parts of Essex, they have seen the rates of virus increase massively amongst the 11 to 18-year-old age group. So in those parts of the country, that school age young people have played a part in the spread of the virus. Interestingly, locally, we haven't seen that same pattern. So in the data for Suffolk, actually, it's much more the 18 to 22-year-olds and the 23 to kind of 39-year-olds. So I don't think it's fixed. The new variant isn't necessarily just about how it only focuses on a younger age group, but I think it depends on where and how it started and where it started to spread. But I think at the moment we need to watch and wait and see what happens. But I think I'd reiterate, it's not necessarily about the age of those young people. It's more about the fact that being close together in those settings may have led to that spreading further. But again, we need to further understand. But as I say, it depends on which area. Suffolk was very different to that. We did start to see the rates increase in that school age group, but not to that same level as what was happening across other parts of London and the southeast.
I can possibly add a little bit because I'm working with quite a lot of schools, not necessarily locally, but nationally. And I found where schools go down, it's because of things that have happened at home. So kids are not necessarily the ones who start spreading it have caught the virus elsewhere, and the occasional parent, well, more than an occasional parent, who's allowed sleepovers during this time, which are really quite ill-advised even for younger children. But it's how well schools are managing the procedures in school. And I know one or two schools where things went a bit pear-shaped, not in Suffolk, but outside of Suffolk, was because staff just got so tired, staff and students just got so tired that they let things slip a bit. So I think it's about the quality of the procedures, how hard we stick to them in schools, but it's also about parents making sure that they're minding where their children go and don't send them off on sleepovers during the pandemic. Hassan, you want to come in?
Yeah, I just thought, I might as well be the one today to play the message like a broken record. And that's that, we can't forget asymptomatic individuals can also spread the virus. And so, we know children at the minute are fortunate or unfortunate, whichever way you look at it, to be able to be in their classes, and so they're more likely to spread it between themselves as they fit in within their bubbles. But as you say, Kushum, it's about when they're at home or wherever they are. It's about the basic principles about social distancing and wearing masks. We mustn't forget that whichever environment we are in, because that's the only way we are going to limit spread, because we can't rely on you having a temperature or cough as you being the one who's going to spread the virus.
How rigid is the 21-day revaccination? That's the 21 days between, I think, the two shots.
There's a range. It's 21 to 35 days, so it's 3 to 5 weeks is the range. Now, obviously, if you give it at 21 days, it's good because you get more people vaccinated quickly. But if you're unwell on that day, there's a little window. And as long as you have it within the next couple of weeks, as far as I'm aware, there is no problem.
Please, can you put the figures into context? You're talking about increased rates of infection, but how does this relate to illness and deaths?
No, I think that's a really good question. The way we tend to look at it is that, as the point was already made, obviously some people will be asymptomatic and necessarily might not know that they have the virus. Other people will have symptoms and they'll get tested. What we tend to find is that you tend to get this delay where from people getting infected about a week or so, 10 days later, you may start to see, if we see the numbers increases in hospital admissions, and then a couple of weeks later from that, we can see the number of deaths unfortunately increase. So what I would say at the moment from the data from Suffolk, and apologies, I don't have these figures for Northeast Essex, but in the first wave, we saw unfortunately about 660 deaths above and beyond what we would expect for a normal year. So these are what you might hear in the news being labelled as excess deaths. What we have seen in the most recent data is an increase in those deaths again. So a couple of weeks ago, we saw, I think there was about 50 more deaths than we would expect based on the 5-year average. Now, some of those, probably about 3/4 of those will be because people had COVID on their death certificate, but other people's not, which is showing that the increase, unfortunately, in the number of cases is directly moving through to that. And we're also seeing an increase in the number of hospital admissions overall. So if you look at the hospitals that cover our areas, such as West Suffolk Hospital, Ipswich Hospital and James Paget, I think we were looking up, we were seeing the number of admissions over the last probably 2 or 3 weeks has more than probably tripled in that sense. So we can look at the cases and numbers; they are increasing significantly. They then lead through to increases in those hospital admissions I've just talked about, and unfortunately the increases in deaths. So there's a very clear pattern there, and this, and that's why I suppose I'm concerned and why we take this so seriously at the moment, looking at the increases that we're experiencing.
Okay, thank you very much, Stuart. I've got another comment. Please remember that there are people who do not have computers to access websites or smartphones as well, which I think is a really important point as well, maintaining a wider range of communication services. I just want to bring, I'll bring Andy in and then just bring Shirley in just to talk a little bit, or just to give a little bit more information about some of the groups that are working locally. Andy?
Yes, yes, please do bring in Shirley. And I just wanted to also say in response to that last message, which is absolutely spot on, we are, as a system, going to be producing a card which will also be scannable on a smartphone, should you want to, when you get your vaccine. And that card will give you information about some key national and local telephone-based services that you can access for anything concerning the health around COVID and the vaccine, but not necessarily just that. So that's really important. We also, in Suffolk, for example, have Home But Not Alone, which is a service that's really, really important. It's been there since March, supporting people for all sorts of things, everything from domestic violence to financial, food, and other concerns. And I believe Healthwatch Essex provide a similar helpline in Essex. Thank you.
Thank you very much. Shirley, do you want to come in and just make the points about some of the groups you work with?
Yes, there was also something that Andy wanted me to bring up in terms of the youth, the young people and what they're saying. So I'll just touch on that first, if that's okay. Some of the feedback we've heard from the youth are that they are very concerned that the vaccine has been done in such a short space of time. So that's one of the things that they're concerned about. The other thing as well is that there's been a lot of myths and conspiracies going around, so they're obviously concerned about what to believe, who to trust, and those are the things that are coming out in conversation. And these are some of the things that came up at a recent event that Dr. Juno and myself hosted amongst the Black community. And one of the things, or other things that they're concerned about are the side effects, as what are the long-term side effects going to be as a result of having the vaccine. So I just wanted to share those things to see if any of the doctors, because some people on the call might be thinking the same thing in terms of the side effects. So I'll finish saying what I'm going to say and then hand that back. The other thing is, in terms of the groups that I mentioned earlier, the befriending project is something very new and that is being rolled out. It is for over 50s in the Black African community and the BAME community. There's going to be a contact number which will be shared so that people can dial in to them. The community Caribbean and African Health Forum are based right in the middle of town centre at Tower Street, 19 Tower Street, so you can find them there if you wanted to pop in and speak to Clem, who is the chair of the charity. In terms of the multicultural service, I'm just mentioning it on behalf of Shadra because she's not here. That is also the Bangladesh and Asian community access to support as well, and they are offering winter packs for those people who are finding it a challenge in terms of food. So they're offering that there as a support service. So if there's anybody who needs support in that, they offer that as well. And they also offer other services as well that will benefit the Asian and Bangladesh community. As for myself, I also offer a lot of health and well-being and lifestyle advice. It's a very person-centered approach. So if there's somebody who can't get a GP appointment, not saying that at the moment, or get into access to speak and want to speak to a health professional, even out of the regular hours, they could contact our service to speak to about any concerns that they might have if they can't get a GP appointment. So I just wanted to share those.
Thank you. Juno, were you going to come in about the issues raised by the young people, the youth? You're on mute. Yeah.
Yes, I'm muted now. Yeah, I'll keep it brief because I know we've only got a couple more minutes. I think that I will just have to tell you these as facts. The messenger RNA vaccine cannot affect your DNA. I've seen various videos circulating suggesting that Bill Gates is saying it can, etc., etc. All I would say is be aware that there are fakes, there are deep fakes, and so it's very easy to believe what you're seeing. which may not be true. But it doesn't affect your DNA, and it can't because it doesn't go into the nucleus of the cell. So that's one answer. Secondly, there's no chip in the vaccine. There's no attempt to try and mind control, etc., etc. But you're just going to have to take my word for that. But I'll give you something which I think is more compelling, and that is that it's very easy for me. One other thing I want to quickly say is that if you are black, if you're a man, if you are brown, and if you get COVID, you're more likely to die from it. Okay, that's the other thing that's terribly important. So people like myself, Hassan, Dr. Chris Uzokwe, etc., who's a black Nigerian, we are all going to have the vaccine. In fact, I've already had the vaccine. So even though, and I had it yesterday, so it would be very easy for me to say, I don't think there's a problem. You don't have to believe any of these facts or this misinformation, what I would classify as misinformation. And if I said, well, I don't believe it, but I won't take the vaccine, then I would be a hypocrite, okay? But I have enough faith in the vaccine to have had my parents vaccinated. They're over 80, they're eligible. I'm a frontline healthcare worker and I'm eligible for one, and I've had it, okay? So I think the answer is that do what we do rather than do what we say, okay? And I think that I have enough faith in it. In terms of long-term complications of the vaccine, I've got to be absolutely frank with you, no one knows. But what we do know is that 10% at least of those people who get COVID actually end up with the so-called long COVID, where you can be very tired, you can be breathless, you have all sorts of problems. So there was nowhere in the trials did they see a 10% long-term complication rate from this vaccine. Okay, it's most likely.
I'm just going to cut you off there because I'm a bit worried we might get cut off. So I'm going to bring Simon in, but I think that's been a really helpful answer.
Thank you very much indeed, June. I do apologise for cutting you off. We're a bit worried about the time on this, actually. So just wanted to say thank you so very much indeed for all our panel members. I'm going to come across to Ed in just a second. But just to say that this meeting has been recorded and we will be sharing it with all of our communities. And it is one of a series of events that we're going to be doing as well. So there'll be more of these in the future. And with that, I'll pass over to Ed.
Thanks, Simon. And just a heartfelt thanks to everyone who's offered a question today, to the panel for all of their honest and expert answers. We've certainly worked Stuart hard tonight, and to Gulshan for chairing the session with such authority. So I hope you found it useful. We'll definitely do this again, and we'll take away all the important points that we've heard. And I think the key message tonight is the importance of the vaccine getting us back to normality, which I'm sure is what we all want to see happen. So do take on board all the messages that have been kindly shared by our panel. So thank you very much, everyone.